What is the most common cause of postpartum hemorrhage? Correct answer is option A, uterine atony. Which of the following is the best method to determine fetal well-being during labor? Correct answer is option A, fetal heart rate monitoring. The primary function of oxytocin during labor is. Correct answer is option B, to enhance uterine contractions. What is the normal range for fetal heart rate during labor? Correct answer is option B, 100 to 160 beats per minute. The most appropriate time for a woman to undergo a caesarean section is. Correct answer is option B, when there is fetal distress. Which of the following is a risk factor for preterm labor? Correct answer is option C, multiple pregnancies. A woman in labor reports sudden onset of severe abdominal pain and vaginal bleeding. What is the most likely diagnosis? Correct answer is option A, placental abruption. What is the recommended method for managing an umbilical cord prolapse? Correct answer is option C, immediate C-section. Which of the following is a primary function of the placenta? Correct answer is option B, exchange of gases, nutrients and waste products. Which of the following best describe the Bishop score? Correct answer is option B, a tool used to assess cervical readiness for labor. Which of the following is a sign of a retained placenta? Correct answer is option A, profuse bleeding after delivery. What is the most common cause of hyperemesis gravidorum? Correct answer is option B, pregnancy hormones. The term crowning in obstetrics refers to. Correct answer is option A, the appearance of the fetal head at the vaginal opening. A 32-week pregnant woman complains of sudden severe headache, visual disturbance, and upper abdominal pain. What is the most likely condition? Correct answer is option A, preeclampsia. Which of the following conditions is contraindication for the use of a vacuum extractor during delivery? Correct answer is option C, cephalopelvic disproportion. The most significant risk factor for developing gestational diabetes is. Correct answer is option B, obesity. A newborn is diagnosed with jaundice on the second day of life. Which of the following is the most likely cause? Correct answer is option A, physiological jaundice. Which medication is commonly used to prevent preterm labor? Correct answer is option C. What is the typical sequence of stages during labor? Correct answer is option B, first, second, third and fourth stage. The most appropriate intervention for a postpartum woman with a fever and pelvic pain is. Correct answer is option A, prescribing antibiotics. Which of the following is the most common complication associated with amniotomy? Correct answer is option B, cord prolapse. Which of the following is the primary action of magnesium sulfate in the treatment of preeclampsia? Correct answer is option B, prevents seizures. A preemie gravida present with severe headache, blurred vision and proteinuria, what is the most likely diagnosis? Correct answer is option B, preeclampsia. A postpartum patient has a firm uterus but heavy vaginal bleeding. The most likely cause is. Correct answer is option C, cervical lacration. The administration of betamethasone during preterm labor is primarily intended to. Correct answer is option B, promote fetal lung maturation. Which of the following is a contraindication for labor induction? Correct answer is option B, placenta previa. Which of the following is a classic sign of labor? Correct answer is option B, lightening. In the case of a prolapsed umbilical cord, the nurse should immediately. Correct answer is option C, prepare the patient for an emergency C-section. Which of the following conditions increases the risk of shoulder dystocia? Correct answer is option A, maternal diabetes. The most common cause of preterm birth is. Correct answer is option D, spontaneous preterm labor. The most important risk factor for the development of a deep vein thrombosis in the postpartum period is. Correct answer is option B, cesarean section delivery. A woman who has just delivered experiences a seizure. The most likely cause is. Correct answer is option A, eclampsia. The primary objective in managing preterm labor is. Correct answer is option A, prolong the pregnancy as much as possible. Which of the following is the first step in managing a postpartum hemorrhage? Correct answer is option A, perform a uterine massage. What is the most significant indicator for the need of a cesarean section? Correct answer is option A, breech presentation. Which of the following is the most common cause of maternal death during pregnancy? Correct answer is option B, pulmonary embolism. Which medication is commonly used to treat postpartum hemorrhage by stimulating uterine contractions? Correct answer is option D, all of the above. In a woman with gestational hypertension, what is the primary goal of treatment? Correct answer is option C, prevent preeclampsia from developing. The term station refers to. Correct answer is option B, the descent of the presenting part of the fetus into the birth canal. What is the normal fetal heart rate range during early pregnancy? Correct answer is option B, 120 to 160 beats per minute. The use of a tocolytic agent in preterm labor is indicated too. Correct answer is option B. Prevent uterine contractions. Which of the following is a complication of an epidural anesthesia during labor? Correct answer is option A. Hypotension. A pregnant woman is diagnosed with iron deficiency anemia. The most appropriate treatment is. Correct answer is option A. Oral iron supplements. What is the recommended weight gain for a woman with a normal BMI during pregnancy? Correct answer is option C. 25 to 35. A woman is diagnosed with placenta previa. Which of the following is most appropriate? Correct answer is option C. Bed rest and observation. Which of the following is a risk factor for developing postpartum depression? Correct answer is option A. History of mental health disorders. Which of the following is the most common indication for performing a C-section? Correct answer is option D. Fetal distress. In the management of a woman with a threatened miscarriage, what is the most appropriate intervention? Correct answer is option B. Bed rest and observation. The primary cause of post-term pregnancy is. Correct answer is option B. A malfunction in the hypothalamic pituitary ovarian. The administration of Rh immunoglobulin is indicated for. Correct answer is option B. Women with a negative Rh factor who deliver an Rh positive baby.